This is a quick review of a patient with multiple sclerosis. Multiple sclerosis can occur at any age. It most commonly begins in people between the ages of 20 and 40. Women are about twice as likely as men to develop multiple sclerosis. The risk of MS is higher for people who have a family history of the disease. A variety of viruses have been linked to MS. Currently, the greatest interest is the association of MS with the Epstein-Barr virus, which is a virus that causes infectious mononucleosis. As the disease progresses, heat sensitivity might be another symptom. In many people, the disease starts with a single symptom, followed by months or even years without any progression of symptoms. In others, the symptoms might become worse within weeks or months. About the first 10 years after the illness begins, symptoms tend to fluctuate with periods of remission, no signs of disease, and relapse, which is recurring. Over half of the MS patients gradually develop increasing neurological disability that can lead to impaired mobility, vision, and coordination. Primary symptoms are a direct result of demyelination. This impairs the transmission of signals to muscles and other organs. The symptoms include weakness, tremors, tingling, numbness, loss of balance, vision impairment, paralysis, and bladder or bowel dysfunction. Secondary symptoms are the result of the primary symptoms. For example, paralysis can lead to pressure sores, and bladder dysfunction can cause frequent recurring urinary tract infections. These symptoms can be treated, but the ideal goal is to avoid them by treating the primary symptoms. Tertiary symptoms are the social, psychological, and vocational complications associated with the primary and secondary symptoms. Depression is an example, which is a common problem among MS patients. Many people with MS have some form of cognitive dysfunction or impaired thinking. The first signs of impaired thinking are often subtle and usually recognized only in retrospect and often by another family member or loved one. This includes difficulty finding the right words to say, troubling remembering tasks, and for most this means slow thinking, decreased concentration, or decreased memory. In only 5 to 10% of MS patients is cognitive dysfunction so severe that it significantly impairs their ability to carry out tasks involved with daily living. Most often, difficulties with cognition occur later in the course of the disease. However, it may occur much earlier, and occasionally it presents with the onset of MS. There is no cure for MS, and treatment typically focuses on combating the autoimmune response and managing the symptoms. Some people have mild symptoms that no treatment is necessary. PT/OT are usually done and occasionally be referred to home health for additional assistance. In collaboration with physical and occupational therapists, an exercise program is developed and includes range of motion exercises, stretching, and strengthening exercises. The patient is encouraged to ambulate as tolerated and to use assistive ambulation devices as needed, including a cane, walker, wheelchair, or electric chair. Additional assisted adaptive devices may be needed to enable the patient with tremor, spasticity, and weakness to remain independent in activities of daily living. The importance of avoiding rigorous activities that increase body temperature may lead to increased fatigue, diminished motor ability, and decreased visual acuity resulting from changes in the conduction abilities of the injured axons. Plasmapheresis has been tried as a treatment for MS, but has mixed results. Botulinum toxin is another one. Normally, the brain sends electrical messages to the muscles so that they can contract and move. This message is transmitted to the muscle by acetylcholine. Botox works to block the release of acetylcholine, so the muscle does not receive the message to contract. One dose works about 1 to 2 weeks and lasts 2 to 6 months. Since symptoms are often vague in the beginning of disease, a good question to ask would be what seems to aggravate the symptoms? Is it fatigue, stress, overexertion, temperature extremes, hot showers, baths? Ask the patient about personality or behavioral changes that have occurred, maybe euphoria, inattentiveness, or maybe recent poor judgment. In addition, determine whether there is a family history. Patients have greater energy in the morning hours and diminished reserves in the afternoon, so it's better to suggest them performing tasks in the morning. Teach them to use assisted devices like a plate guard, because proper nutrition is basic to health and adapting utensils and foods can facilitate meeting nutritional needs. Prevent major complications of immobility. Focus the teaching on building general resistance to the illness, avoiding fatigue, extremes of hot and cold, exposure to infection. Maintaining a relatively constant body temperature may avoid exacerbations of the disorder. Heat can delay impulse transmission across demyelinated nerves, which contributes to the fatigue. Increase fluid intake to 2,000 mL daily. Have a bowel routine to prevent constipation, and they may need to self-catheterize as necessary. Maintaining optimal bowel and bladder function decreases the risk of urinary tract infection. One of the main differences between MS and other neurological disorders is the loss of peripheral vision, and the patient must do their activities in the morning. Discharge to home, let them know to get enough rest. Fatigue is a common symptom of MS, and getting adequate rest may help the patient feel less tired. Exercise. Maintain normal daily activities as best as they can. Regular aerobic exercise may offer some benefits for mild to moderate MS. Benefits include improved strength, muscle tone, balance and coordination, and help with depression. Swimming is a good option for people with MS who are bothered by heat. So careful with the heat. Extreme heat may cause extreme muscle weakness. Although some people with MS aren't bothered by heat and may actually like their warm baths and showers, the patient must still be very careful before exposure to extreme heat until they know how they're going to react. They should not get into a hot tub or a sauna unless there's somebody nearby who can pull them out if necessary. If they do experience heat-related worsening signs and symptoms, cooling down for a few hours usually return them to a normal state. Tepid or cool baths may also help provide some relief. A diet. Eating a healthy, well-balanced diet can help keep the immune system strong. Coping skills. As it is true with other chronic diseases, living with MS can place the patient on a roller coaster of emotions. It's important that they stay connected with friends and family. Continue to pursue hobbies that they enjoy, and if they're able to do so. Remember that physical health can directly impact mental health. Counselors and therapists may help the patient put things in perspective and can also teach coping skills and relaxation techniques that may be helpful. Sometimes joining a support group where they can share experiences and feelings with other people is a good approach.